Good evening. Happy Wednesday. I'm your host, Shameika Rhymes, and this is Soulibration. Let me know where you are watching from and how you're doing this evening. I already see Asheville checking in. So, this week on Soulibration, we're diving into how aging impacts your teeth and gums and what you can do about it. From dry mouth and gum disease to bone loss, shifting teeth, oral health changes sometimes go overlooked or sometimes you just don't think about it. So, we're going to talk about surprising ways that life stages, including menopause, can affect your smile and share everyday habits to keep it strong and healthy at every age. Now, remember to share this with your network. If you have any questions at all, because you guys are the co hosts, drop it in the chat. So, let me introduce you to tonight's guest. Well, you've seen her here before. Dr. Kim Anderson is back. She is a graduate of the University of Michigan and the Meharry Medical College School of Dentistry, and she has been in practice since 1995. Wait a minute. That's an anniversary, I think, 30 years. A co owner of Dazzling Dentistry in Charlotte, North Carolina, and Dobie's Bridge Dentistry in Fort Mill, South Carolina. Let's welcome Dr. Anderson back. Hi, Dr. Anderson.
Hi, Shameika.
How are you?
I'm doing great. How are you?
I'm doing well. Did I get the math right? Is it 30 years in
It's
practice?
30 years. Can you believe it?
Wow.
We're celebrating it.
Congratulations.
Thank you. We're celebrating a big anniversary this year.
What are y'all doing to celebrate? Now I got to know. I'm nosy.
Well, well, we've been recognizing all of our OG patients, patients that have been in the practice for 25 to 30 years and 20 years even. We're taking pictures with all of them. We're shouting them out on social media. We're just taking some time to kind of reflect on the last 30 years. So it's been a lot of fun.
I love that. Hi, Teresa. I see you in the chat. Charlotte's already checking in tonight. So let's get into this because I feel like over the past few weeks, I have seen on TikTok and other platforms, I've seen people talking about dental health, oral health, and just different aspects of it. But some of it always comes back to aging. And, I thought about it today as I was prepping for tonight's show, and I was like, oh gosh, I'm aging another year older tomorrow. My birthday's tomorrow. So
Well,
I was
happy
like, let me make sure I
birthday.
floss.
Yeah, it's Virgo season.
Yes.
I think mine is next week,
I didn't know
Sunday,
you were a
maybe.
Virgo.
Yeah,
No wonder we get along.
absolutely.
Hey, Lynette McCallum, I see you in there. She says, hey, Dr. Anderson.
Hi, Lynette.
So, what are the most common changes that people experience in their teeth and gums as they age?
Okay, so one of the things that I've observed as I've been in practice for a long time now, and I've watched my patient population age, um, is that we don't bounce back as quickly as we used to. Okay.
Mhm.
And that's pretty normal. I mean, you probably see that in other areas of your health, is that as we age, things don't
Right.
quite go back as quickly. We have, when things happen, sometimes it takes a little bit more to fix it. Okay.
Mhm.
And that's what I see on my patients too, is as we age, sometimes it requires a different level of attention than it took when we were younger. Okay.
Yeah.
Um, One of the things that I tell my patients that I know to be true because I've been able to do it over these 30 years is that when we have good home care and we combine that with good dentistry, then we have less problems as the aging process begins to occur. Okay. I mean, we're
Mhm.
always getting older. There's nothing we can do about that.
Right.
But what we can do is take really good care of ourselves. And that's what I tell my patients.
So, what about when you throw those pesky hormones into the mix? How does that affect our oral health?
Yeah, so there aren't a lot of studies necessarily to that are long term. There's more coming out about how I guess specifically women
Mhm.
have how women's oral health changes as we age. One of the things that I see that's readily recognizable is that women don't heal as quick. Okay,
Hmm.
so when we do surgery, when we do various procedures that involve um, manipulation of the gum tissue, it doesn't heal quite as quickly as it did when they were younger, and it doesn't heal quite as quickly as maybe men who are of the same age. Okay.
Hmm.
And the hormonal differences or hormonal changes, I think, are one of the things that affect that. Okay. That doesn't mean that you can't get your dental treatment done. It just means that we have to care for it a little bit
Hmm.
differently and maybe a little bit more carefully.
I do remember actually somebody messaged me about this on TikTok, but they were saying that they noticed as they are in that perimenopause, menopause stage that they have more cavities now than they've never had cavities until now. What causes that?
Well, the changes in the bacterial load in the mouth can be
Hmm.
different. And then sometimes what we're eating is different and what we're drinking is different as well. So the mouth sometimes gets drier as we age. Salivary function can decrease along with the quality of the saliva.
Hmm.
And then you combine that with maybe some pre-existing medical conditions. Maybe in your 20s and 30s you didn't have high blood pressure, but now in your
Yeah.
40s and 50s you're taking medication for high blood pressure. You might also be taking medication for um, chronic sinus issues. You might
Hmm.
also be taking medications for weight loss.
Hmm.
And so all of those things can make the mouth drier, which contributes to tooth decay. So maybe you didn't change anything that you were normally doing, but some
Hmm.
things about your mouth and your overall health might have changed.
Okay, that explains it. Okay, so it sounds like women, we be going through it
Yes,
as
we
we
do.
age.
We
But what
do.
about the men? What do they get? What challenges do they have as they get older with their mouth?
Well, they get a lot of the same issues. I think that um, for men, the thing that's probably different is that, well, sometimes they just don't come in. They don't
Mhm,
come in. I see more women on a regular basis than I do men. That's not to say men don't go to the dentist, because they do. It's
mhm,
just that I think women are more they're more likely, because they're used to going to the doctor for other things,
right.
so I would say most of our patients are women. I think for men, they go through a lot of the same things because they get high blood pressure, they get diabetes, they get other medical conditions. And but I think that maybe it affects women a little bit more because we tend to maybe have more, there's more load, you know.
Mhm.
um and like I said, women are sometimes just more susceptible, just because of our biological makeup, to get some of these conditions, and it may affect us a little bit more than it does affect men.
Okay, so men, you got to go to the dentist.
Yes, they
Like,
do. Yes, men need to take care of their oral health. And and then too, with women, remember, we have the babies, and there's a lot of hormonal changes when, during pregnancy. And that's another thing I don't want us to skip over. Women of childbearing age, it's important, if you're thinking about having a baby, if you might be having a baby, go to your dentist,
mhm,
just to get everything checked out. Having undiagnosed periodontal disease, untreated periodontal disease, can affect your baby in adverse way. It can cause low gestational weight. It can cause preterm labor. I mean, those things are really, really important. And already, as Black women, we tend to
mhm.
have more issues in pregnancy than the larger population. So having your mouth not be healthy just makes that just worse.
Wow, I had no idea. I mean, I guess I've seen things about how like our mouths impact the rest of the body, but I guess you don't think about that, and
Yeah.
especially if you're about to have a baby either, you're probably not thinking about that at all.
Probably not thinking about
Yeah.
it. But if there was advice that I could give to people in their 20s and 30s, or, in their 40s, if they're choosing to have children, get a dental checkup. Make
Hmm.
sure that you don't have any underlying disease that can make that situation. I mean, you're already in a precarious situation. So
Right.
let's not, make it even worse with having dental disease that can affect your pregnancy.
Well, speaking of this, it just brought to mind that some people are absolutely terrified of the dentist.
Yeah.
So, what does that, just for those that are watching that may feel like, like these men, I'm not going to the dentist because I'm scared. What
Yeah.
can you tell them what that exam is like just to ease their fears?
Absolutely. So at Dazzling and at Dobies, my partner and I and our whole team, we really try to make it as easy for people as possible. I realize that there are some people, due to previous situations, or times that they've had at the dentist, that they're afraid.
Hmm.
But we try to use techniques. We tell people what we're going to do, we show them what we're going to do, and then we do it.
Hmm.
And so I really try to do that and be honest with what people are going to feel. um, so that's the first thing, is that we try to create a relationship. And I think when people trust you, they are more likely to follow the directions.
Hmm.
Okay. So that's the first thing we try to do, is instill some trust and let them know that we care and that we're not going to do anything to hurt them. Okay. I have lots of patients that I prescribe medication to, that makes them less anxious. And that seems to work really well. I've got many patients that we give them some medication first, and then they're able to get their dental treatment done. They don't quite care so much about what we're doing,
Hmm.
and it makes everybody's life easier, you know.
Hmm.
And eventually, we can often transition those people to not need the medication anymore. I've got lots of patients that they started out using medication, but then over the years, we've
Hmm.
gotten to the place that I can do treatment on them and they don't even need it anymore. And so that's a really wonderful thing to have happen, is that we can start to have those fears lessen and lessen over time.
You know, nobody ever gave me anything. They just said, "Sit down, open your mouth."
Yeah, we just said, Shamika, sit in the chair and be quiet.
Basically.
I know, right? It worked.
Oh, I see Dr. Swain in the chat. Hey, Dr. Swain.
Hey.
Let's see here, and let's see, Teresa. That is great to hear that she does go to the dentist, but she hates the dentist. But maybe you should check out Dazzling Dentistry.
Absolutely.
So, what role does bone loss play in tooth health as we age?
Okay, so I don't want to get too sciencey, but basically, our teeth are sitting in our jawbone, okay,
Hmm.
along with, and our teeth are connected to that jawbone with a series of blood vessels and ligaments and connective tissue. Okay,
Hmm.
and so as during the menopause time, that's when sometime, or perimenopause, where as women we start to lose bone in other areas of our bodies, and unfortunately, the bone that surrounds the teeth is also at risk. Okay. So that's another reason why it's really important to visit the dentist and for us to check the bone that the teeth are in to make sure it's healthy. And then to offer suggestions and and treatment to make sure that we're trying to preserve that bone as much as possible.
Okay. You guys, don't forget, if you have questions, please drop it in the chat. Let's see. Oh, Teresa says she had a bad experience
Yeah,
that
bad
messed her up years
experiences
ago.
can be a challenge.
Hmm.
But if she's in the Charlotte area, or if she's in a drivable distance, I mean, we have lots of patients who come from all over the Southeast that come and see us, and we try to do our very best to take care of people and to recognize the fears and acknowledge them, and then try to work past it.
Hmm. Well, how about aging increasing the risk of gum disease or tooth loss? Is
Yeah,
is that
so the
kind of
loss of
what
that
happens?
absolutely. The loss of that bone is what causes the tooth loss. So the
Mm,
bone that surrounds the teeth, we call it alveolar bone. So when the alveolar bone is lost, either due to periodontal disease or the osteoporotic process, the
mhm.
teeth start to move. Okay, and once the teeth get loose, it gets really challenging for us to try to keep the teeth in the mouth.
So I'm about to sound real ignorant right now,
No,
so
it's okay.
forgive me.
No.
So I see a lot of people always talking about this in like on social media. It's always a meme about how older black people are always missing a side tooth.
Okay.
What causes that? Is that something maybe that teeth were shifting and or decay or
So, usually teeth are lost due to one of two reasons, either tooth decay or due to bone loss. Okay.
Mhm.
Now, I suspect that a lot of times when it's a side tooth, it was due to decay because those teeth are smaller, less surface area, so decay spreads really quickly on those teeth. Okay. So
Mhm.
I guess what I'm trying to say is that the smaller teeth are more difficult to repair or treat once the decay has spread to a certain extent. Now, the molar teeth, the big teeth in the back, they're
Mhm.
bigger. So the same amount of decay may not cause that tooth to be non-restorable. Does that make
Gotcha.
sense?
That
Okay.
does, yes.
And so many times what people will do is they'll opt to have that tooth extracted, the smaller tooth, because it might take more treatment, more money, more time to fix it.
Mhm.
Okay. Um, my suggestion for people when they come in and they've got decay on those teeth is that we need to fix it as soon as possible. But
Mhm.
sometimes people can, sometimes they can do that and sometimes they can't do it quickly enough and to keep the
Yeah.
tooth from being lost. Okay. And so there are those times we have to take out the side
Sorry, I didn't mean to ask that, but it was like I guess every time I'm on social media, somebody is pointing it out on
yeah.
somebody.
Well, the thing I think is really good is that younger people are seeing that. And so now
Mhm.
they're like, okay, I don't want my side tooth gone because, we talk about that. And
Yeah.
so people are, understanding that it's important to restore those teeth because, everybody sees it, on social media, you always see the lady
Right.
who smiles and then there's no tooth over there, and
Mhm.
so you want
Yeah.
to, yeah, we try to, and then if the tooth is lost, we do have ways to to replace it.
Mhm.
It's just a matter of education, I think, and letting people
Yeah.
know what is going to happen. And I think that's the thing that we try to do really well is explain to people what the problem is, what's going to happen if they don't do anything about it, and then offer them a solution.
Mhm. Well, I think people should also stop picking on people that are missing teeth.
I think so too, because it
Yeah.
can be fixed. It can be fixed. It's just a matter
Yeah.
of education and
Mhm.
getting in and getting it taken care of before it becomes, before that tooth becomes a loss.
Let's see. Lynette McCallum has a question. She says, "What are the best practices to keep our teeth, the enamel? Is it fluoride?"
Um, so I like to keep it really simple. Okay. I know right now in social media, there's all these different things that people are suggesting that you do, whether it's swishing with um, coconut oil or
Mhm.
um, using various things in your mouth. But what I've seen that works really well, okay, is that doing three things. I'm big in like three steps, okay? So, of course, trying to have a good diet. So, keep
Mhm.
the sugar to a minimum, especially the drinkable sugar. Okay.
Mhm.
The sugar combines with the plaque in our mouths. Okay.
Yeah.
And it create the waste product is the sugar and the bacteria getting together, the waste product is tooth decay. So if you could keep your mouth clean with brushing, so that'd be the second thing. So the sugar, especially the drinkable sugar, home care, and then visiting the dentist. Those are the three things that you can, if you did those three things,
Hmm.
usually we can control the tooth decay. Now, fluoride is what we call a preventive measure, and it helps make the teeth less more resistant to tooth decay. All right, so that's
Hmm.
one of the benefits of fluoride. I know that right now in social media and in it's a big topic right now as to what it does. The fluoride that we use in dentistry is not a poison. Okay.
Hmm.
um we use it in my house. I you know I believe that fluoride is a great decay preventer. I've seen it. I've also seen people who don't have fluoride and they have more
Hmm.
cavities. So, if you're choosing not to use fluoride, then, I mean, and I understand that I've got some patients who, they don't want to use it, and that's fine. And I support them by letting them know what they need to do at home. And so that means you need to probably eliminate some things from your diet, but you can't have it both ways. You can't like say, oh, I'm not going to use the fluoride, but I'm going to, eat the gummy nerds or whatever it is that
Right.
that people eat all the time, that chewy sticky candy. You can't. Or and smoking too. Smoking is another thing. It holds the staining and holds on to the plaque, and so that makes more tooth decay. And if you think of smoking like cooking your gum tissue, anything you cook is dead. All right, so you're
Hmm.
basically killing your gum tissue. Our skin in our mouth, which is the gums, it's alive. It's a living thing, just like your
Hmm.
skin, on your body is alive. It's considered an organ. Okay,
Yeah.
so you're killing it when you smoke. So that's another thing that really helps to prevent dental disease too, is not smoking, not drinking alcohol to excess, and controlling the sugar that you drink.
Okay. All right. I had not heard about that coconut oil thing you just mentioned.
Yeah, I
People,
get a lot of patients asking about it. It's a big thing on TikTok.
y'all got to stop doing everything you see on TikTok.
Well, I get asked about it a lot.
Wow. I'm now, of course, after this, I'm going to have to go look on TikTok to see what these
Yeah, go
people are
look it up.
doing.
I mean, and there's not a lot of evidence to say it does, that it's either helpful or harmful, but I
Hmm.
don't think that you have to swish for 5 minutes with you know grease. You can you can brush for 2 minutes in the proper way. You can floss, that takes a minute. Being mindful about what you're drinking and eating, you know and I think that's how we create good dental health.
Hmm. Well, how does aging affect like if you've already got dental work, say like crowns, fillings, or implants? How does
Absolutely.
aging affect that?
All right. So, well, first of all, having good dental care,
Hmm.
even if you're getting your teeth fixed and everything, you want to make sure that you come in regularly. But I just want to say too that when you've had good dental care, and I get it, life sometimes, and people don't may not they might miss an appointment, or they might miss a year of coming in, but doing what you need to do at home is always a good idea. Okay, so that's the first thing. As
Hmm.
we age, I think there needs to be a recognition that the mouth's going to change. It just does, like everything else changes when
Hmm.
we age. And so when I talk to my patients who are in their 40s and 50s and beyond, it's with that in mind. It's okay, you're in your 40s now. It's time to make sure that we're paying attention to home care, maybe a lot more than we did when you were younger. Okay, the
Hmm.
fact that in your 20s and 30s you might not have had as much susceptibility to tooth decay, but as you get older, the environment in the mouth changes. So you
Hmm.
need to make sure you're doing your home care, maybe doing more cavity prevention, like a fluoride rinse at home, or we have prescription toothpaste that we recommend to people when we think that they might need that for more, for additional cavity protection. The more dental work you have, the more likely it is that at some point we might have to replace some of it due to tooth decay. And that's what I tell people, is that that's why keeping everything clean is the most important thing that you can do. Um, and I don't ask my patients to do anything that, and I'm not asking you to spend 10 minutes, every day, but you might need to spend about 4 or 5 twice a
Hmm.
day to make sure that you're doing that. And then, like I said, not doing those other things. I think a lot of times our habits are,
Hmm.
your habits are what your life is built on. Okay, so if you have the habit of brushing and flossing, and then not, eating cookies before you go to bed, and drinking a 16-ounce Coke, before bedtime, or sipping on soda all day long, those are the things that cause tooth decay. And like I said, over time,
Hmm.
is, and especially as we age, our mouths become less resistant to the decay process.
Yeah, my dentist talked to me about this as I'm aging. So it's good to know that she said the same thing.
Yeah, we had that conversation, didn't we?
In case you want to know, Dr. Anderson is my dentist.
Well, I think it's important to realize. I think we don't think about our mouths being a part of the aging process. We see it in other parts of our bodies, that
Hmm.
things are changing, but we don't often think of our mouths as being as aging as well. And I think that, you know um, the good thing about social media as well is that I think people are finding more out about that this part of the body is a gateway to the rest of the body.
Hmm.
And so, when you're talking about aging, sometimes, as we get older, we develop other chronic health conditions. Diabetes and hypertension are the two big ones in our
Hmm.
community. And so I think it's really important for us to talk about how our what role our dental health plays in both of those conditions. So I can tell you that more and more is coming out about how the mouth affects our heart and heart disease. And heart disease is the number one killer of men and women. Okay.
Hmm.
And so, understanding that that bacteria that lives in your mouth can travel through your bloodstream and affect your heart, that's really, really key to trying to help people stay alive, and healthy.
Yeah.
Okay. Um, Diabetes, although diabetes isn't caused by periodontal disease, it can definitely be affected. And so when people are diabetic and they have periodontal disease, usually their blood sugar is harder to control because there's bacteria in your mouth that affects the blood sugar. More diabetics lose their teeth because of periodontal disease.
Wow. Can you explain what periodontal disease is just for those that may not be aware?
Absolutely, absolutely. So, periodontal disease is when the bacteria in the mouth, it basically causes an immune reaction, and that reaction causes the alveolar bone that we discussed before. It
Hmm.
causes it basically eats away at the bone and the ligaments that hold your teeth in your mouth. So it's usually characterized by bleeding gum tissue when you brush or floss. Sometimes it's characterized by a foul taste or a foul odor um,
Hmm.
coming from the mouth. And then sometimes there are no symptoms at all. We find it when we check your oral health during a dental exam. Okay. One of the things though that's pretty consistent with diabetics is that their periodontal disease is worse, okay, and harder to control sometimes.
Hmm.
So we want to make sure that, prevention, we want to prevent periodontal disease as much as possible, and that's with catching it early and then treating it properly.
Hmm.
In our practice, we we check all of our patients yearly. and we take radiographs so that we can start to see the alveolar bone if it's so we can see it. So if we need to talk to patients about um, bone loss, we can do it early. Okay.
Okay. You guys, if you have questions, make sure you drop it in the chat. We got a few more minutes. So, are there any treatments or products that can help with sensitivity, receding gums, or even dry mouth that we've mentioned before?
Absolutely. So there are lots of products out right now that can help with sensitivity. Um, Sensodyne is kind of the standard. It's been around for a long time. They have several different formulations now. I think that one of the issues with Sensodyne in the past is that maybe it didn't taste so good, but
Hmm.
now they've made it much more palatable. It tastes better, and like I said, there's lots of um, um, different products that Sensodyne has out right now. Um, and then you asked about something else, the
Let's see.
sensitivity.
It was receding gums and dry mouth.
Receding gums. Okay, so receding gum tissue is more is something that I would suggest that you prevent versus trying to treat it. Trying to treat it is probably not the most fun thing. It involves surgery sometimes
Hmm.
to replace the gum tissue. So brushing properly, and that's something that we go over in the practice, is we educate people on the proper method to use the toothbrush.
Hmm.
Also to make sure you change your toothbrush. That's probably the thing I see a lot, is that people want to, have that toothbrush last for 6 months. And you really need to be changing your toothbrush about every 12 weeks or so.
Okay. Y'all hear that? I literally this morning was like, it's time to change my toothbrush.
Yeah, yeah. You want to change your toothbrush frequently. When the bristles start to go in other directions, the toothbrush not effective.
Hmm. Let's see. I don't think there's no. Well, thank you, Teresa. She says this is great information.
Oh,
How can
wonderful.
people advocate for their dental health if their dentist isn't bringing any of this stuff up? How can people advocate for their dental health, especially when it's age related?
Hmm. Well, I think that, kind of doing what we do is ask
Hmm.
questions. If you're
Yeah.
concerned about anything that your dentist is telling you, um, definitely ask questions. And if you're getting to be in that age group, maybe perimenopausal, or getting to
Hmm.
be in your 40s or whatever, make sure you talk to them, and because it's a partnership. It's at least it should be.
Hmm.
It should be a relationship that we can have a conversation about what's going on, and then how best to treat it, and what we expect what would be the outcome. you know
Right.
we Dr. Swain and I try to create a plan for our patients, and it has a even though it's not that it has an end, but it also continues because it goes through maintenance. Okay,
Hmm.
so what it looks like is that we want to treat the disease. Okay, so make sure that that all gets done properly, and then we want to maintain. Okay,
Hmm.
it's just that sometimes, for whatever reason, sometimes people can never get to the maintenance. Okay, but if you
Hmm.
can get to the maintenance, then usually we can, that's we're in a maintenance phase for years.
Yeah.
um Many patients, we might start out where we have to kind of repair things and fix
Hmm.
things, but then we eventually get to a place where we've stopped that, and then we're just taking care of what's already been done and making sure that the mouth stays healthy.
It's a process, y'all.
It's a process.
It's a
Yes,
process.
absolutely. And I know you didn't ask about this, but a lot of times people are concerned about cost.
I was just about to ask that, so I'm glad you're bringing it up.
Yes, cost is a very real thing.
Hmm.
So not to I mean, I don't want to belabor dental insurance a lot, but dental insurance hasn't really kept up with the technology that we have in dentistry.
Hmm.
Most people have the same maximum that they had in 20 in the year 2000. This is
Yeah.
2025. you
Hmm.
know um Many times they have maximums that are the same as in the 1990 something. If we were still practicing dentistry like we did in the 90s, you probably wouldn't come. Do you know what I
Right.
mean? So you have to remember that technology, I mean, we have digital dentistry, we have the technology that we have now is just so amazing. Okay.
Hmm.
That and all of that comes with a cost. And I think that sometimes we're made to feel like oh, it's the dentists who are driving up costs, but the technology that people want, we have it, and we gotta use
Yeah.
it. You know what I mean? It has to
Hmm.
be paid for. And
Hmm.
so and dental insurance isn't really serving that. They don't, it's not like they care about the fact that your treatment today is different than your treatment 30 years ago, whereas it's
Right.
still paying, the maximums are from 30 years ago.
Hmm.
Most dentists, I think, are trying to create plans so that patients can afford it. We try to do in-house financing. We try to do um, more or less kind of insurance plans that people can buy that discount their dentist, so they can get a discount on their dentistry. Because I'll be honest with you, dental insurance is not really what it's supposed to be. And I think
Hmm.
that's probably the more tragic thing, is that people pay so much for these plans, through their employer, and they don't get back what they think that
Right.
they should be getting back. And unfortunately, what happens is they either don't come to the dentist, or they, don't get their needs met, and they end up with lots and lots of treatment when they finally do come. So then,
Hmm.
yeah, that part is a challenge when your maximum is $2,000, but you need $10,000 worth of treatment.
Right. Yeah. So it's almost like I was just thinking if you have an FSA plan or HRA
Yeah,
or something, and you're having to make sure you're putting enough in there in case you have to go to the dentist. It's a whole
right.
like it's a lot. But what about the people that just don't even have insurance at all, or they don't, and maybe they're as the economy right now, a lot of people are unemployed and they
Yeah,
need
absolutely.
dental work. So what do you say to those people? What should they do?
Well, my suggestion would be is to try to do all the other things.
Hmm.
Do what you can at home, and we try to make at least an exam and x-rays as affordable as we can. Okay.
Hmm.
And we also have in office insurance, kind of a discount plan
Hmm.
that people can buy. Okay,
Okay.
it's a yearly fee, I think, and it discounts treatment. It discounts, you get, I think it comes with a two cleanings a year or something like that you don't have to pay for.
Hmm.
And so that may be an alternative. Um, there are uh, there aren't a lot of places that people can go for sliding scale or no
Yeah.
fee in the city. There are a few, and so you might want to check. I mean, there's a couple in the public health, that if people have emergencies or that kind of thing, they can go in and maybe get emergency treatment. Um, and that's one of the big challenges, is trying to provide care when people, have either no coverage or inadequate coverage, or no, you know,
Hmm.
they're not financially able to, to pay for treatment.
Right.
But we try as best we can in our practice to provide care where there's a gap. But it's a challenge. We can't, like, I mean, we are running a business, so we have to be mindful of that. But Dr. Swain and I are committed to helping our community. We try to give away treatment at least once a year. We do open up the office, and we just treat everybody that walks in the door.
What day is that?
Yeah.
Like what day?
You'll be volunteering with us that day. Okay. You'll have to
I
come
can I
over.
can read X-rays.
Yeah. You'll come over and be a volunteer that day. Okay.
Yeah, just let me know. Just let me know.
We'll let you know the next time we have, it's we did a dazzling day a few years ago, and we're going to be scheduling another one coming up soon.
Oh, cool. That is great. There was just one other question I just thought about. I skipped it earlier, but I want to go back to it. What are some signs that in the mouth that could be, and you kind of touched on it a little bit, but that there's something bigger going on? Like, is there something people should be like, like this, I shouldn't ignore this. I need to go get this
Exactly.
checked out,
And
or yeah, go to a doctor as well to get this
yeah,
checked
it's
out.
interesting that you should ask that. We've had a couple of cases where we've diagnosed cancer just
Mm.
this past year. I think Dr. Swain has already saved two people's lives this year.
Wow.
Yeah, yeah. I had one as well where we diagnosed oral cancer. Both of these people, I think all of them had been regular patients, and we just noticed something that didn't look right.
Hmm.
And and then once you talk to the person, and you do all the your doctor stuff, and
Yeah.
then we sent them for biopsies, and both and all and those cases came back that they had cancer. And so it
Yes.
was pretty intense to get everything taken care of. Luckily, everybody is doing okay.
Good.
But it definitely does happen. So anything that you see in your mouth that's a sore or doesn't heal, or any kind of irritation that has lasted for
Hmm.
longer than a month, you need to come in so that we can take a look at it.
Hmm. I'm good at like, do you know what this is? What is
Absolutely. And
this?
that's what you have to do. If you
Yeah.
see anything, if you feel anything, if you see any kind of discoloration in your
Hmm.
mouth, or a lump or a bump, you need to come in so that we can take a look at it. Okay.
Yes, that's
Absolutely. And
good.
that's a very real thing.
It is.
Especially if you have, and none of these people, to my recollection, had pre had any predisposition. They weren't smokers,
Mm.
and they weren't drinkers. You know, of course, we always associate,
Right.
oral cancer with certain habits. And I don't think any of those people would fall into that category. So that is kind of scary, that
Hmm.
you have people who really don't have any predisposing, lifestyle habits, who are getting cancer.
Oh, Teresa says her mom had oral bone cancer. She lost half of her jaw and her tongue, and it was her dentist that discovered it.
Yeah,
Wow.
yeah, that's very real.
So, as we wrap up, what is one thing you want everybody to remember, either from this conversation or something we didn't get to when it comes to oral health and aging?
Hmm. I would suggest that the main thing is to do your to do good home care. You know,
Hmm.
I realize that sometimes people are like, well, I haven't been able to see the dentist in 2 years or whatever, but you can absolutely buy a toothbrush and some dental floss.
Hmm.
Okay. And there are YouTube videos on how to do everything. And you can definitely YouTube how to brush and floss your teeth properly.
Hmm.
Okay. So those are the things I would do. And then try to maintain a healthy diet. I tell people, juice is not a food group, neither is soda.
Hmm.
People forget that sports drinks are also high in sugar, and if those that
Yeah.
are sugar free still are very acidic. And
Hmm.
decay it loves an acidic environment. So eliminating those things from your diet as much as possible. I've got
Hmm.
lots of athletes that are patients of mine, and so we have to talk about how to get your electrolytes and all your nutrients without using a product or without using something that's going to make you have cavities. A lot of athletes have a lot of tooth decay because of the things they drink. So there's other things that are available that don't cause tooth decay. So I
Hmm.
would say that trying to drink things and eat things that are healthy, especially as you age, get plenty of water,
Hmm.
um, and do what makes sense. Good home care is where it all starts. If you can prevent tooth decay, that will that's the key right there.
Mhm. Okay. Well, I know I asked you this the last time, but just in case the answer changed, what feeds your soul?
Oh man. So I'm incredibly blessed to be able to work with amazing people every day,
Hmm.
and to do good work. That feeds my soul. I have a fabulous husband who supports me and is always ready to do whatever I ask him to do. That helps, you know. um, and my kid, he's doing well in school. Shout out to Noah. And I think his friends are watching too, so that's cool. um that feeds my soul. I mean, and like I said, I'm incredibly blessed to have a wonderful family and doing great work, and we have an amazing team at Dazzling and at Dobie's Bridge, and to get to do this with you and trying to help people, it's just wonderful. And I'm just so lucky
Hmm.
to be able to do this, and then to be able to do it for so long and really see how we've been able to make an impact.
I love that. I love that. Teresa, are you asking me this question? She's she said, "What feeds your soul?"
Yeah, what feeds your soul, Shameika?
This platform, Soulibration, and just blackdoctor.org as a whole, this feeds my soul every single week. It really does. Being able to help. I'm not a medical professional, but being able to at least help in this way and
Right.
make an impact. So that's what feeds my soul. And if people walk away with, just even a nugget or two, then I'm like, I did my job. So yeah.
Absolutely.
Yeah.
Absolutely. Yeah, I feel the same way. Not everybody, um sometimes people, will get all their treatment done that we suggest, and sometimes not. But I always feel like if I've done my best to explain everything and to educate, and then people get to choose,
Hmm.
then I've done what I was supposed to do. And the really wonderful thing is that I've had some great success. I've seen people go from, like I said, having lots of issues to we minimize it. They're coming in, they don't need medication anymore. And that's really a great thing, you know.
Yeah.
And when people bring their kids in, and that's another thing, is that now I'm treating the children, the grown children of some of some of my patients that we met years ago. And so
Hmm.
that's very satisfying.
Yeah, and it's always a fun time at Dazzling Dentistry. Like the
Yeah,
music, the playlist.
that's right. We play good music. So y'all should come over. We have a good time. It's the 90s in there, right?
It is. It is. Thank you, Dr. Anderson, for coming back on the show to talk about, aging and oral health, because I think it's an important topic that sometimes kind of falls through the cracks where we don't talk about it enough. So I appreciate, when I brought it up to you and you were like, yeah, let's do it. So thank you.
Oh, it's my pleasure.
Well, everybody, for more information on oral health and everything we talked about today, home care, all of it, you can head over to blackdoctor.org. There's plenty of articles and resources there. I don't believe I have Celebration next week because we do have a kids summit next week. So I'll still see you guys, but just not for Celebration. But I'll catch you the following week, I think. So have a soul filled rest of this week, though. Thank you for watching. Have a good night.
Thank you.